So Caitlin is prepping our surgery room for Ginger today. We're going to do her inferior check ligament desmotomy, which means we're going to cut through the check ligament to free up movement of the deep digital flexor tendon so her foot is not contracted back that way. We've coordinated that with Elijah, the farrier, so hopefully within a few minutes of us finishing up, he'll be able to trim it down, and we'll see how it goes. So, but she's doing final prep, getting everything good and clean in here, because we will be laying her down. I'm not going to try to do it standing, and we will be cutting through the tendon, so we want to keep things nice and sterile, clean environment, the whole 9 yards today. So I'm just getting ready for Ginger's surgery, putting together some surgery packs. The packs are actually in the autoclave right now. Been cleaning up some instruments as well, and I'm going to go ahead and put some that will end up being in little pouches like this autoclaved. That way, if we decide we need something that's not in the main pouch, then we can easily open up one of the autoclave pouches and add to our surgery kits. So one of those, we've got our checklist of everything should be in there, but sometimes you change game plan, things like that. So it never hurts to have extra on hand available to open up in a hurry when you need them.
Hi everybody, haven't seen you in so long. I'm really excited to be here today. I haven't gotten to work with the Horse Plus team in a bit. I've been super busy at my other job, but I've never been the doctor to perform the surgery. I've seen it happen a lot, and I'm excited. Today, Dr. Nancy is going to show me how to do this procedure to fix this clubfoot. So it's going to be really exciting. It's always really helpful to have an extra set of veterinary hands, not just for the technical stuff, but understanding sterile technique and all that kind of stuff. But Dr. Nancy's fast and precise, and so she's going to talk me through how to do this procedure. So I'm excited about that. I'm happy to be here. And yeah, it's always fun to learn new stuff. This isn't something I've had the opportunity to do.
We'll go ahead and do a beginning scrub before we take you in.
So the most challenging part of this procedure is maintaining sterility. We're going to actually open the tendon sheath. These tendons run in a sterile tube, basically, that's bathed in joint fluid, and so we have to open that to get to the part that we need to. So making sure that there's no hair at the incision site and that we're really, really as sterile as possible is going to be critical. So Dr. Nancy's doing an amazing job prepping the site. This is really important, and then the aftercare and those bandage changes are really important. So this is something that you probably only could do with a full-time veterinarian, because this is going to need some intense aftercare and some really careful sterile bandage changes. Man, you can like see the atrophy on this limb, even this low down.
Yeah, I mean, you can feel how tight that is down through there, yeah. Okay, sweetheart.
We're almost ready. Dr. Nancy.
Yes.
Do you want post-op bandaging stuff?
Yes.
Ready to go? What type bandage? Like
a non-stick.
I've got big ones.
Okay, got big and non-stick.
I've got 2 big telfas.
Okay.
If we need extra absorption / it said pressure bandage, this is antimicrobial.
Okay.
We can do that on top. Do you want any topical on the surgical wound, or do you like to just leave it as is?
We can do a little SSD to be on the safe side.
Great.
That way. Yeah, I'm gonna hedge bets and put her on antibiotics just to be on the safe side.
Okay, I'm gonna get a brand new SSD container so we don't have any. So this diagram shows an incision made parallel to, and your diagram, are you gonna make skin incision parallel to? Okay.
Yes.
Perfect.
So I'm going to do xylazine and ketamine on her to lay her down.
Okay.
And midazolam.
Love it.
And then we can top off as we need to. Okay, sweetheart, this is just your xylazine and your torb to get you a little sleepier.
So the most important thing you're gonna see Kimberly do is keep her body well away. When she goes down, we don't want those legs to come out and accidentally kick somebody. So it's okay, it's okay. That's all right. This is just lube to make sure that her eyes don't get dried out during the procedure. So if you watch, I'm not wearing gloves right now, but I'm making sure that no part of my ungloved hand is gonna touch our surgical site. We're just gonna alternate between our chlorhexidine that's gonna kind of provide some lasting antimicrobial presence there, and then the alcohol, which kind of serves as a surfactant to kind of rinse all the stuff away. And Dr. Nancy's already completed a really thorough prep before induction. But we don't want an infection in that tendon sheath, so. I'm on my last scrub, Dr. Nancy.
Okay. Okay, those are our drapes. There. Which there's a big one and there's a small one, so there's a big one.
And she's gonna need a scalpel blade as well. So if you wanna get ready to open one of those, they're the little blue and silver right there in the, nope, just a tiny, yes.
Okay. Are we ready? Yeah, that's what I said. This is the
Love it.
part that totally is fascinating once you realize it.
Yeah. Is that your tendon sheath right there?
It should be tendon sheath, yeah.
Do you want any lidocaine or anything like that?
Yeah, let's go ahead and be
Perfect.
Okay.
So this syringe is not sterile,
Okay.
but I'm happy to
Go ahead and
put it where you are if you want to direct.
Just both of
Sub-Q?
Yeah.
Okay.
And a little bit in the tendon itself there.
Okay, redirecting. Okay.
Okay, let's
Happy with
put a
that?
little bit right in
Okay.
there.
Injecting?
Yep. There we go. I'll feel better about that, darling.
Yeah. Beautiful. There you got it.
Yep.
I can see
Okay.
it. Yep.
Yep.
Beautiful.
Okay.
See how shiny and white that is? That is the tendon itself. So that looks like it is the deep digital flexor tendon, and that's one of our landmarks.
Now our superficial
Yeah.
should be right here.
Yep.
This should be our deep. Now we got to find where our check ligament comes in, so we may have to actually go a little higher on her.
Okay, ready?
Yep.
Here we go. We know that what we're looking for lies between here and here. We've opened what we have and we don't have, so I can palpate deep here. I would open this fascia. We have a big vessel right there. I don't know name of it, but like I see a vessel right there. We're gonna have to be careful. I would make a little nick here and see if we can open this up a little bit more, and maybe we'll find it. You want me to do
that?
it?
And I'm
Okay.
going to top her off in the meantime.
Okay. Got it. I have a lot of tension.
Twist it around towards the backside further.
I feel pretty confident. Kimberly, can you take the green and straighten the leg for me? Yep, that's it. Okay, you can back up. That's it. Got it. All right, Dr. Nancy, I'm gonna have you confirm.
Okay,
and I'm
I
happy
still
to
don't have her
you
chopped
take
off.
back over.
No.
But I feel pretty confident that this is the check ligament. We have deep here. We have superficial here. This is branching off of superficial and running up towards. And it's definitely a separate entity that's under greater tension when we move.
Okay.
I'm gonna release it because I can get it back again. So this is what we had before. When you feel deep down here, I can feel a structure under more tension. And the only way I can get it out, like described in the book, was blunt dissection. And I had to kind of work my way into getting this.
Perfect.
But if you feel, I'm gonna trade places with you in just a second. If you feel, when you try to extend the limb, this is like rock hard and under more tension than the superficial. So I feel fairly confident that this should be what we're looking at.
Perfect. Cut
Is
it.
this larger than what you were transecting before?
No, it should be about the same size, and that
Perfect.
looks right. So.
Perfect. I feel really good about this based on origin and insertion. Kimberly, why don't we go ahead and irrigate this again?
There we go.
Okay, yep, and just irrigate for me. Perfect.
Everybody ready?
Look how tough this is. Here we go.
Is that it?
That was it.
Yep.
Can you guys see both ends of the
Now.
tendon? Let's go ahead and irrigate again.
Wow. There's like a lot
Yep,
of
there it goes.
space, too.
Yep. Yay!
After this, we just need to close up.
Okay, closed tendon sheath.
Yep.
And then
tendon sheath.
subcuticular.
Yep.
Am I stepping on your toes if I
No.
close stuff? I love suturing so much. You really don't mind if I close?
No.
Thank you.
Okay.
And we're just going simple continuous?
Yep. Simple continuous.
All right, let's test
Okay.
limb extension. That looks pretty close to normal.
Get it
If the
trimmed
farrier
down.
can get that, yep, love
So
it.
do you want to move this out of the way to make
Yeah.
it easier?
You know, actually, I've got one more throw.
Okay, I want to stay here just in case.
Okay.
So.
And I am tying the knot. Are you gonna bite me? I love you so much.
Like I'm threatening.
Are you gonna bite me? She just went.
I know, I saw her like,
I know, all we have to do is wrap it.
look at her.
Yeah, you're gonna need some physical therapy, I think. You can put your foot down.
So how much, as far as the toe extension goes, how much leverage would we be wanting to apply at this point?
She probably has some adhesions in her other parts of her tendon sheath, but if you ignore her hoof and just look at her leg, the angle of her fetlock is now consistent. It's actually less upright than the other one. So it's probably gonna take some time
For sure.
for that hoof to grow out, but I don't.
Yeah, and so a toe extension is gonna help push everything back down into place, but I don't wanna do too much and tear something.
Yeah.
Do you have an opinion as far as a happy medium there?
Dr. Nancy's
Dr.
the boss.
Nancy.
You're not really going to tear anything because we actually have to stretch it out.
Right,
Yeah.
and I guess it's not gonna go further down than the heels
No,
touching the ground, so, okay.
No,
good deal.
because with her is we've cut it, and the ideal is we don't want it to just scar back down together exactly where it was. Because
Right,
eventually,
yeah, for
long term, it will scar back down together.
For sure.
So, yeah, unfortunately,
All right.
a little bit of pressure is what it's going to take to be able to get it.
Yep. So we're just gonna do a quick little sketch of our foot, get a rough idea as far as size.
Yeah.
And then we'll glue this on and we'll kind of rasp it down to shape. So we're just sketching a rough outline of the bottom of her foot. I'm gonna go cut this out and I'm gonna leave enough around the toe to where we're bringing the platform of her foot out to where her toe should be. So we're essentially bringing her breakover point forward. That's it's not a perfect way to describe it, but we're putting more leverage on her toe. And so it'll force her to push her heel down. She doesn't have the length in her tendon to allow her to do that right now, but as stuff stretches out, it'll help get her foot back in the correct position. Won't be able to smell it from the other side of the camera, but this is a sassafras tree, so this wood kind of smells like root beer. And we'll go and we'll soften up all the edges and clean this up with a file.
She put herself there. She's like leaning into the wall with her head too.
We can massage to keep the swelling down in there and some light walking, but no major running around because that's going to encourage it to scar down in there, and we don't want it to scar.
Because once I put this glue out, I've got a few, maybe 15, 30 seconds of work time before it starts hardening it up. Easy. Thank you. And now we've got to build this up. And then we'll lay the saran wrap.
Are you gonna need the saran wrap?
Yeah, we need to
Okay.
saran wrap the top of this. Just stretch it real tight.
Okay.
And awkward. Yeah, this helps it. Trying to, yeah. And saran wrap also helps it cure harder. Okay.
Okay.
It's just a waiting game.
Okay.
And hopefully she'll let this.
Do you want a timer started?
I'll feel it get hot and I'll feel it harden up.
Okay.
And I just want it to be able to take the stress of her foot before we put it down so it doesn't
Okay,
pop right
yep.
off. Yeah, man, it's getting hot now. I think I might be able to put this down now. I'm gonna try. It's gonna take her a while to figure out.
Yeah,
how
I can say it's going
stand.
to take an adjustment for her.
So this bump here, is this simply just the top of her coronary band, or is there some sort of scar tissue or something here as well?
There may be scar tissue in there. Yeah.
Feels like there's some distinct, I guess, could this just, is this
could
the
be
end
pulling
of,
so
end
tight,
of her,
yeah,
her coronary bone? Is that just the end of P2?
How often do we have to do her?
We'll see what it looks like tomorrow, but about every 3 to 4 days if everything's good.
The vets went ahead and did a tenotomy on this foal, and we got her fitted with a toe extension. I wasn't able to bring my shoeing rig with me today, and I wasn't able to build a steel shoe for her just because of the way my day was going. So we actually fitted her with a wooden clog and did a glue-on with it. So we're gonna see how that does, see how long it holds up. We might pull that and replace it with another wooden clog once that comes off, or we might pull it and replace it with a shoe at some point. We're just gonna play it by ear and see how she responds to it and see what she needs. Yeah, everything went really well. She behaved pretty well, at least for my part. I wasn't here for the rest. But yeah, she behaved well for me, and everything looks good, and I'm happy with the finished product, so hopefully it'll help her out.
Okay, so Ginger had her surgery today. Little bit different anatomy than we were expecting. Had to go digging for it a little bit more, but Dr. Lydia found it as we got it cut, and Elijah, our farrier, did put on a little bit of a block, so it's been so tight, it's gonna take a little bit of time for her to learn that she can use it to stretch out everything. So a little bit of time, physical therapy. We hopefully, fingers still crossed, that everything works out good with her. So.
I learned a ton today. I'm excited to try it again. Thankfully, Dr. Nancy had practiced and reviewed all the anatomy, because we did hit a point where when anatomy is not normal, that's when you kind of hit that moment where you're like, all right, we gotta try this.
We gotta figure something out.
But it was really helpful to be able to flex and extend that foot. And it's really difficult to tell on camera, but I think if you look at her, hi, are you gonna try to bite me again? I don't blame you. If you look at the leg itself has the ability to be in a normal position. The hoof itself has been in such an abnormal position that it still looks really abnormal. So it's gonna take a long time for that hoof to grow back out, but she at least has the capability to do that now. And with a full-time vet here, being able to do sterile bandage changes and the physical therapy, and oh, that feels, whatever you're doing, she likes that. She says that feels nice. But yeah, and oh my goodness, the padded surgery room is amazing. And it was cold here today, and it was really nice and warm in the surgery room, so all of those things are really, really awesome. And thank you, Dr. Nancy, for teaching me all of the things. Learned a lot. It's always a good day when you learn how to do new things. But it's also exciting because there's a lot of clubfoot surgeries out there, right? So I would totally do this again.